Hello everyone, my name is Brittany Heckler. I'm an LPN to BSN student at Indiana State University. I am currently taking Nurse 444 Community Health Nursing for the spring 2022 semester. This is my fifth community health nursing project and it's on breast cancer. Populations at risk. Women are more susceptible to getting cancer, and most breast cancer in women is diagnosed after the age of 50. Men are also susceptible to getting breast cancer, however, it is less common than in women. The learning objectives for this presentation are: the viewer will be able to define breast cancer, the viewer will be able to summarize the population at risk for breast cancer, the viewer will be able to distinguish the different types of breast cancer, the viewer will be able to recall what to look for when performing a breast self-exam, the viewer will be able to recognize possible symptoms of breast cancer, the viewer will be able to explain the tests necessary to diagnose breast cancer. At this time, please take a moment to pause this presentation and take the pre-quiz. The link is located below in the video description, or copy and paste the link on this slide in your internet browser. Okay, let's get back to the presentation and see how everyone did on the pre-quiz. What is breast cancer? Breast cancer is a disease in which cells in the breast grow out of control. Breast cancer can begin in different parts of the breast, and there are different kinds of breast cancer. The type of breast cancer depends on which cells in the breast turn into cancer. A breast is made up of three main parts: lobules, ducts, and connective tissue. The lobules are the glands that produce milk. The ducts are tubes that carry milk to the nipple. The connective tissue surrounds and holds everything together. Most breast cancers begin in the ducts or lobules. Breast cancer can spread outside through blood vessels and lymph vessels. When breast cancer spreads to other parts of the body, it is said to have metastasized. Kinds of breast cancer. The most common kinds of breast cancer are invasive ductal carcinoma, cancer cells that begin in the ducts and then grow outside the ducts into other parts of the breast tissues. Invasive cancer cells can also spread or metastasize to other parts of the body. Invasive lobular carcinoma. Cancer cells begin in the lobules and then spread from the lobules to the breast tissues that are close by. These invasive cancer cells can also spread to other parts of the body. There are several other less common kinds of breast cancer, such as Paget's disease, medullary, mucinous, and inflammatory breast cancer. Ductal carcinoma in situ is a breast disease that may lead to invasive breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. Symptoms of breast cancer. Different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. Some warning signs of breast cancer are a new lump in the breast or underarm, thickening or swelling of the part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size or the shape of the breast, pain in any area of the breast. Keep in mind that these symptoms can happen with other conditions that are not cancer. If you have any signs or symptoms that worry you, be sure to see your doctor right away. Risk factors you can and cannot change. The main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Some women will get breast cancer even without any other risk factors that they know of. Having a risk factor does not mean you will get the disease, and not all risk factors have the same effect. Most women have some risk factors, but most women do not get breast cancer. Risk factors that cannot be changed: getting older, genetic mutations, reproductive history, having dense breasts, personal history of breast cancer or certain non-cancerous breast diseases, family history of breast or ovarian cancer, previous treatment using radiation therapy. Risk factors that can be changed: not being physically active, being overweight or having obesity after menopause, taking hormones, reproductive history, or drinking alcohol. What can you do to reduce the risk of getting breast cancer? Many factors over the course of a lifetime can influence your breast cancer risk. You can't change some factors, such as getting older or family history, but you can help lower your risk of breast cancer by taking care of your health in the following ways. Keep a healthy weight, exercise regularly, don't drink alcohol or limit alcoholic drinks. If you are taking or have been told to take hormone replacement therapy or oral contraceptives, which is birth control pills, ask your doctor about the risks and find out if it is right for you. Breastfeed your children if possible. If you have a family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, talk to your doctor about other ways to lower your risk. Staying healthy throughout your life will lower your risk of developing cancer and improves your chances of surviving cancer if it occurs. Some breast cancer screening tests that may be required to diagnose breast cancer are a mammogram. It's an X-ray picture of the breast. A breast magnetic resonance imaging, which is an MRI, uses magnets and radio waves to take pictures of the breast. A clinical breast exam. A breast exam done by a doctor or a nurse who uses hands to examine the breast. Breast self-awareness. Being familiar with how your breasts feel and look will help you with noticing differences. So the benefits of a screening test are to find cancer early. This is so that it's easier to treat. Some risks for the screenings are you can have a false positive test results, a false negative test results, having a doctor overdiagnose you, which then leads to overtreatment. Breast self-examination. When to do self-breast examination. Do breast self-examination once a month and familiarize yourself with how your breasts normally look and feel. Keep a track of your observations and consult a doctor if you see any major changes. The best time to do it is in the shower. Extend your right arm upward and examine left breast. And then extend your left arm upward and examine right breast. You can also do this in the bed. While laying down, insert a pillow under your right shoulder, making your right breast flat. Put your right arm under your head and examine your right breast. Repeat the same with the left breast. You can also do this in front of a mirror. Inspect both breasts with your arms at your sides. Raise your arms slowly, paying close attention to any swelling or change in your breast or nipples. Place your hands on your hips, flex your chest muscles, and again, visually compare both breasts. Now, what you're looking for when you're doing these breast self-examinations are a change in size, shape, or color of the breast, dimpling, puckering, or bulging of the skin around the breast, change in nipples position or nipple pushed upward, redness, soreness, rash, or swelling in the breast. Last but not least, always pay attention to your body and any changes that you see. How is breast cancer diagnosed and treated? Doctors often use additional tests to find or diagnose breast cancer. A breast ultrasound. This is a machine that uses sound waves to make pictures called sonograms of the areas inside the breast. A diagnostic mammogram. This is more detailed X-ray of the breast. A breast magnetic resonance imaging, MRI, is a detailed picture of areas inside the breast. A biopsy. This is a test that removes tissue or fluid from the breast to be looked at under a microscope and to do more testing. Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. It may require surgery, an operation where doctors cut out cancer tissue. Chemotherapy, using special medications to shrink or kill the cancer cells. The drugs can be pills you take or medications given in your veins or sometimes both. Hormonal therapy blocks cancer cells from getting the hormones they need to grow. Biological therapy works with your body's immune system to help it fight cancer cells or to control side effects from other cancer treatments. Radiation therapy, using high-energy rays like X-rays to kill the cancer cells. There are many great resources out there. There are 4 that I have listed below. The first is the American Cancer Society. It is a great website to find out about breast cancer and other types of cancer. Breastcancer.org has resources and information and support groups for people suffering from breast cancer or may have a family member that they know is suffering from breast cancer. Centers for Disease Control is always a go-to for me for any ailment that might come my way or for information that I need to know, especially breast cancer. The World Health Organization is also a great resource for support systems and things in place to help people with breast cancer. The references I used for this presentation are the American Cancer Society, breastcancer.org, the CDC, and the World Health Organization. Thank you for viewing this presentation. After this slide, please take a moment to take the post quiz. The link is located below in the video description, or copy and paste the link on this slide on your internet browser.